The holidays are a time of joy that we get to spend with our closest relatives and friends. But for those who are currently suffering from diabetes, it can also be a very difficult time. Today, we have board-certified family medicine physician, Dr. Jennifer Driscoll with Baptist Medical Group, to give us information on how you can still enjoy the holidays while keeping your diabetes under control. Thanks for being here.
Well, thank you, Jeff. It's my pleasure.
Well, it's always a pleasure to have you here. And before we get started, tell us a little bit about yourself and your practice here in the Pensacola area.
Surely. Well, I'm a family physician with Baptist Medical Group. My practice is located in North Hill, right across from Baptist Hospital's main campus. As a primary care physician, I treat a wide range of conditions, and one of the more common conditions I treat is diabetes.
Okay. Well, let's just start right there. For those who may not know as much as maybe they would like to know about diabetes, just tell us a little bit about the disease itself and some of the symptoms.
Sure. Well, diabetes is a chronic disease, and the hallmark of diabetes is high blood sugar. The high blood sugar can be caused by either the body not making enough insulin or not using the insulin the body makes. But regardless, the culprit is high blood sugar. And high blood sugar can be toxic to the blood vessels in the body and can cause damage. And the reason we're always so concerned about diabetes is that it can cause damage like stroke, heart attacks, blindness, dialysis and kidney failure, and even a poor circulation to the feet, which leads to infections, trauma, and amputations.
So what type of symptoms would someone see before it got to, progressed
Before
to
it
those
gets that
stages?
bad, certainly. The most common signs are increased thirst and increased urination, and that's because of the high sugars in the blood are drawing the water out of the body, and so people get dehydrated. They can also have blurred vision and dizziness. Some people don't even realize they have it. They come into the doctor's office or the emergency room and we check their sugar and it's high.
Okay, so yes, holidays and sweets. So let's talk a little bit about how we can manage that and still participate in all the fun holiday activities, and food is a big part of the holidays.
Absolutely. Well, there's several challenges to diabetics during the holidays. One is it's a hectic time. So a diabetic can sometimes forget to take their medications that help them control their blood sugar. It's also sometimes a stressful time. It's good to see the grandchildren, but sometimes having 20 people at dinner is stressful.
It's good to see them go as well, huh?
Absolutely. And that can cause your body to release stress hormones that increase your blood sugar. But probably the most common thing is it's a tempting time. You know, we as Southerners tend to celebrate holidays and gatherings with good Southern cooking, and that means good cookies and candies and homemade pies, and that can wreak havoc on a diabetic's diet.
Well, now, should people with diabetes just totally avoid all these nice holiday cookies, or is there a way to say moderation is key? What kind of advice would you give to someone going to a nice party with a full table of sweets?
Well, I think people with diabetes need to be realistic, and I don't think refraining from all sweets and treats is realistic. As you said, moderation is the key. So you don't want to eat mindlessly. No sense eating half a package of Oreos when you could have a little bit of Aunt Sally's award-winning pecan pie, for example. So again, you don't want to overindulge. That's not realistic, but a forkful or two of tasting something that's really special to you is important. The other thing is to know where sugars are hidden, and this surprises a lot of diabetics. Sugars aren't just the cake and the sweets, but it's also the starches. So that means mashed potatoes, corn, pudding, rice, bread, pasta. But we also get a lot of sugars in our drinks. And if I had one holiday wish for diabetics, it would be to avoid the sweet tea, avoid the sweet sodas, and even alcohol. That has a lot of sugars. So with a little forethought, a diabetic can indulge a little taste here and there of special sweets, but not go overboard and shoot their blood sugar sky high.
Okay. Well, you mentioned stress earlier, having family around. A lot of times there's stress with traveling right now with winter storms and things like that. So when people are preparing to go on a long trip, as far as just fuel to keep the body going so there's not these ups and downs, what should people do, or what should they take with them to make sure they are eating along the way?
Well, that's a great question. And first I want to address probably a preparation plan that people don't think about, but that's getting the flu shot. You really, really should get the flu shot. The flu is here, and before you travel and start interacting with lots of people on the planes, you should really get that flu shot. Not just diabetics, but all people. But as far as a diabetic, again, you want to make sure you have enough medications. You may get stranded at Atlanta Airport. You want to make sure you have enough medications to last a few days extra on your trip. And you want to make sure you have a plan for eating. If you're taking medications for diabetes and you don't eat, sometimes that can cause your blood sugar to go low. So having some crackers in your purse, some lifesavers, and just making plans to not overdo it and take breaks to eat regularly is important when you're traveling.
Okay, and what would be the signs that someone is maybe not managing the diabetes properly? They're trying, they're doing some of these things, taking medication, but can it get off to some degree that they would notice and be able to come back and talk with someone like yourself?
Certainly. All diabetics should be checking their blood sugar once a day, especially during the holiday season when they might be tempted to go off their regular diet. So when their blood sugars start rising, if it goes up a little bit and they know what they did wrong, well, that's sort of the warning shot across the bow, the chance to improve their diet a little bit. But if it gets dangerously high, above 200 or a number that you and your doctor have discussed, then you should call your doctor and see what you need to do.
What are some of the questions that you get from patients, concerns they may have or things they may be noticing, or just questions that feedback as well?
Well, a lot of diabetics ask me not to check their lab values in January because they want a free pass on the holidays. But unfortunately, the damage to your blood vessels doesn't take a holiday. So it's important, again, moderation and to watch your diet. Another great thing that I stress with patients is to increase their exercise. We're blessed with mild weather, usually, during the holidays, and getting out and taking a walk can lower your blood sugar and improve your mental health. So I highly recommend trying to get out there and do a little more walking during the holidays and a little more fresh air and exercise.
That's great advice. Well, what would you recommend to somebody who has watched this program today and thinks, well, some of that sounds what I may be experiencing? What would you recommend someone to do who wants to find out?
Well, I recommend that everyone should visit their primary care doctor at least once a year. If you don't have a primary care doctor, now's a great time to get one. Checking for diabetes is a simple blood test. And again, some people don't even realize that they've sort of crept into the diabetes stage. Early detection and early treatment can prevent those serious complications down the road.
Are there any particular age groups that you see, or you're seeing this now across the board?
I do. I do see it across the board. Of course, it's more common in the over 40, over 50 or so age group. Certainly with a strong family history of diabetes or being overweight, increase your risk of diabetes. But I'm also seeing it in the younger age groups in the 20s and 30s nowadays.
Everybody needs to be paying attention.
Absolutely.
Well, thanks for being here. It's great information.
Well, thank you so much.
We'll be right back with more Coming of Age and a telephone service for the hearing impaired.